Okay, we are live and we're going to go ahead and start now. Wanted to wait for a few people to show up. Well, thanks so much for being a part of this presentation. This is the second of 12 in a series of creating a culture of compliance with HIPAA, OSHA, Medicare, and HR. Big part of that is leadership, so we'll be talking about leadership at the end, and we'll certainly be addressing that in this presentation. Of course, leadership is just paramount when considering culture, how things should be communicated and integrated throughout an organization. We're going to talk a little bit more about that. I want to thank you, though, for being here. I really think this will be valuable at the level of a physician, a level of a consultant, as a HIPAA compliance officer. And so I really appreciate you being here. Well, before we begin, take a minute to read through this and count the number of F's in this paragraph, if you would, please. The number of F's in this paragraph. Give you another 10 seconds. 3, 2, 1. Okay. How many did you find? I'd be interested in just a quick comment below. So many have seen 3 F's. Many, it looks like, have seen 6 in looking over this paragraph. So the answer is that there are 6 F's. Now, how could you get 6 and how could you get 3? Well, if you look at this paragraph, this sentence, really, people will find the F in finished, in files. They'll look at the F in scientific. However, they will forget the F in of, and there is an of placed in 3 different parts sentence. This is just a quick example of how important it is to focus on the details, but how often details are overlooked. And a lot of presentations out there will talk about how to develop culture given, an organization culture, culture in a society. We're talking about a culture of compliance, which is often missed, and people have paid dearly for that. Now, one thing I hope to instill in each of the viewers of the presentation is that really, if you think about it, after you've established a kind of a general culture in an organization, boy, compliance is just part of that. It just has to be one and the same. So we'll talk a little bit more about that. Well, who am I? My name is Lance King. I'm fortunate to be here at Healthcare Compliance Solutions. I'm the Vice President of Sales here, which is a lot of fun for me. Personally, I am living here in Utah. I'm in Salt Lake City. I've been blessed with a wife and 3 really cute and often sassy little girls. and we have a lot of fun with our little girls with, it's soccer season right now. So a lot of soccer, a lot of gymnastics. We do horseback riding with them and lots of games. They love to sing and they love to do little acting sessions. So we have a lot of fun at the house. We love to exercise. I love to help people to do more with less. I think the results of implementing a presentation like this and integrating a culture of compliance really is more efficiency, really is being able to do more with less. Now, Healthcare Compliance Solutions has that mission, and that's why we've developed a HIPAA, OSHA, Medicare, HR compliance program. It really is an all-in-one program to help people have peace of mind. And then that comes with the relationship that we develop as we support a culture of compliance in the practice. And we feel that's best done with the compliance officer. So we hope compliance officers are here. And so we will help you to understand how to communicate a culture of compliance, help you to feel like you can take ownership of what's happening, feel like you can have some autonomy. Now, why am I here at HCSI? I think this is important. One of my daughters, Malia, to the right, she went into the hospital for a very small, well, we thought it was small. It was RSV, which I know some people have actually passed away from RSV. We went not knowing much about it, knowing that she did have it, and we were hopeful that she'd be in and out of a hospital in a couple of days. And I say a couple of days because she was life flighted to Primary Children's Hospital in Utah. I'm a pretty young father. I didn't really know how long she'd be there, but I surfaced this because my wife and I dealt with an OSHA breach, and it caused my daughter to we nearly lost her as a result of an environment that, boy, they did a good job, but they didn't do as good as they should have, wearing protected equipment and the sanitary environment where you've got two babies in the same room, sometimes three. Just this particular year, 2 years ago, in 2015, it really was a challenge for this hospital. But boy, the longer she was there, the worse she got, until kids started getting out of that room and they started really focusing on her. And my wife, she mentioned many times, I feel like people aren't washing their hands enough, and boy, their hands must have been white as a result of how many times they're washing their hands. So boy, my heart went out to them. I'm not upset at them. I didn't file a complaint at all. I love that hospital. I'm so grateful for what they did to serve our family. So grateful that we donate a portion of our sales to the Ronald McDonald House at the Primary Children's. So I just want families to be protected, and I know Primary Children's is one of the most sanitary of any hospital around. People are flown to Primary Children's all the time. Also, the picture you see before me is somebody that is showing frustration. My wife and I went through identity theft where her information was stolen, and it took nearly a year, maybe a little over a year, to completely recover from those damages. And my wife is a brunette. The person that took her information and was using it was a blonde, which I thought was really wild, seeing pictures of her and seeing that she looked nothing like my wife. But patient information is a gold mine for people. I mean, you've got insurance information, social security numbers, date of birth, everything needed to get into a lot of things. And so I'm part of HCSI. I want to protect families. This is an opportunity for me to protect families. And for those of you watching this is an opportunity for you to protect families, protect them from taking what I've heard is an average of 300 hours for individuals to recover from identity theft. Well, thank you for being here. Here's what to expect today. I want to go through the 5 most common reasons for an audit. I typically go through this every single presentation because I think not enough people are aware of how what the common reasons are. And you may find it instructive that most of these reasons have to do with what's happening internally. Also, your timeline. If you are audited, I think this needs to be something people talk more about. It can take 90 days or more if you are audited. And that I can just see being a nightmare for a lot of people. We're going to go through, of course, the main part of this is creating a culture of compliance. I actually think you're going to find this presentation to be a little bit different than you may have originally thought it would be like, because we're going to have an angle of leadership involved here. I think it's important that we talk about the 7 steps to HIPAA compliance. You've got to have that education before you can create the culture, and have to have that know-how. Also, how to conduct a self-audit. That's definitely part of this culture. In fact, we would argue one of the most important things in maintaining. And we'll introduce you to compliance solutions internally, having somebody come into your office, and as well as an option that we have as well, which is online. Okay, so we realize there's only 168 hours in a week. We appreciate you spending an hour with us today. Wanted to just outline real quick the 6 different things that you're faced with right now. We understand patients are the most important thing, and then staff and front desk, and you've got all these different variables. And we realize that at the beginning of that week, you really only have so much that you can offer to these many different classes. And so often compliance is left empty. I mean, ask yourself, what have you done this past week for compliance? Consultants, what have you done, if you're consulting on compliance, to educate on compliance? Now, we realize kind of where we're at when it comes to all the other services and things that are on your priority list, and we have a ways to go before we climb that. But as we see a shift with technology emerging into several new medical devices and different communication platforms, we're going to find this really is going to be a much higher priority on a lot of people's lists. And if you're here today, you're demonstrating that it is a high priority. Many of you may relate to this picture. We all have systems, several different systems, but quite frankly, many offices I've been to, well, they look pretty much like this. Patient records all over the place, names all over the desktop screen and sticky notes. So yeah, I love that. If we ever forget our username or password, we just look up one of the sticky notes. So is this kind of I would say a diagram that illustrates your role as a physician, and this can be related in many ways, kind of the story of a physician-patient relationship. So the patient comes in, they have a problem. The problem is so there's a patient, they have a problem, they go to the physician for guidance. And I'll tell you, we do that with all humility, and some of us, it takes a long time before we can develop that courage. The physician provides a plan of action. In that plan of action, there's a proposal, and that proposal, if acted on, can produce a positive or a negative result. And argue, well, it's always a positive in helping us to delineate what the solution for that person is going to be. But I'll tell you from personal experience, I remember as a kid being put on a lot of prescriptive drugs just to calm me down. There was this really energetic uh, spirit inside this body, and this body was just really little and didn't know how to control the body effectively enough. But I went through a lot of prescription types of drugs, and in my experience, the more we whittled down all of the prescriptions, the better I got, to where I was able to become completely removed. And that's my story. That doesn't always happen. I know I have some aunts that have taken prescriptive drugs their whole life for things that they've been dealing with, and they feel that that's something they'll always take. But this is kind of your role, and the trust here that patients put in that guide, that physician, the plan, the action they take on the proposal. I mean, this is all, all of these inner workings take place, and don't think a whole lot about, because we're so focused on what has been an issue and wanting to overcome that. We don't even think about what's happened to our information. In fact, we give you everything that you ask for, don't we? We just want to be healed. And so we put a lot of trust, but I'll tell you, when things happen where things are a breach, I'm telling you that reputation you have, it really will spoil the number of patients that come to you for that advice. As a result of breaches, and increase of technology, audits have been increasing significantly. If you follow our LinkedIn group, you'll see weekly new finds, new audits that have come out in different segments of the healthcare industry, whether it's business associates and varying degrees of healthcare providers. But with the increase of apps, online resources for patients to access healthcare records, cloud storage, the use of mobile devices to improve communication, and there's just so many new emerging technologies, as I mentioned earlier. So there's a need that is increasing daily to develop this culture of compliance. Well, 5 common circumstances for an audit. You have a disgruntled ex-employee who turns you in to get back at the employer. You have a self-reported breach, which is required by HHS. An employee activist who may anonymously contact the Office for Civil Rights. Those patients that believe their information has been breached or believe someone else's information is in jeopardy. Or the Office for Civil Rights randomly visiting a practice as they are actively doing right now. And if they start auditing your area as well for someone's breach, in Texas, we had someone, it was an internal medicine practice. One person was audited, and then the whole community, it seemed, of physicians in that area that were internal medicine physicians began to be audited. So those are some common issues, ways of being audited. Here's the timeline. Again, I mentioned it can take 90 days if you look at the whole timeline. And for your information, what happens is a notification letter is mailed. You'll receive an email requesting certain documentation and notifying you that you're being investigated. And then you'll go to their website where you'll upload certain documentation. You'll be asked to prepare certain documentation, mail certain documentation, and provide proof of ongoing compliance being implemented by a compliance representative. When they go on site, they ask to talk to somebody that is representing the compliance program. Doctors, probably not the best position to be in if you're the person doing compliance. If you can delegate this, my goodness, take this off your shoulders, because again, they're looking for an ongoing process. And auditors know that you're focused more on the patients, and Certainly in some circumstances, you can do the compliance. If you're a really, really small practice with really unique circumstances, okay, fair enough. But then there's the argument I've heard where some small practices will contact a company like us because they have all these other things that they're working on, and to give time to compliance when their hands are already full of all these juggling balls of healthcare services and everything else. Boy, it can be really, really challenging. Well, after they do the on-site field work, which can take up to 90 days, they draft an audit report. Then they give corrective action. It's reviewed, commented, and then there's a final audit report with preventative action, and certainly there's follow-up. So creating a culture of compliance. Let me just point out 5 different ways of doing this after I tell you a quick story. So you may have heard in the last presentation, it's worth reiterating that a student healthcare worker, Catherine, was fired from the University of Iowa Healthcare Center because she violated the privacy of a pregnant female student and her well-known athlete boyfriend. She'd worked there for 14 years, receiving HIPAA privacy training, but that didn't stop her from revealing out loud to at least one of her coworkers that, quote, she hoped the young couple was happy and with the positive results of the pregnancy test. So there she is, just, very, concerned person. I don't know. I think she had some good intentions, but far as to point out the student to the clerk after she noticed, the student athlete to the clerk after she noticed him in the waiting room. And again, this is a healthcare worker that was a student. So this other athlete was kind of a big deal. But then she also inappropriately accessed the patient's chart at least twice, opening the records from past visits and medication records as well. I've heard that happening a lot with celebrities, Britney Spears in particular. The clerk then went and spoke to 2 medical assistants who treated the female student who was pregnant and asked about the couple's reaction to the news of the test. Well, the medical assistants reported the inquiry to a manager as a possible privacy violation. So they did have some procedures on how to act, and they did have some measures called sanction policies in place to provide the necessary discipline. What we're saying in creating a culture of compliance is you need to deliberately create a culture that emphasizes PHI confidentiality, protected health information confidentiality. Celebrity, student, athlete, whatever, it has. Again, we as patients go in and we just hope to leave with our information safe and secure. And we never even think that somebody would talk about us. But we're curious, right? We as human beings really can be overly curious. Now, you can create a culture of compliance by doing several things. So the first is speaking often about the importance of trust in the patient-provider relationship, reminding your workforce that patients expect your practice to be a good steward of their information. Continually reminding staff through training on PHI safeguards, making sure that the staff have a copy of your policies and procedures for easy reference. Remind them to comply regularly, especially as things change. Address staff regularly with their questions and perhaps get some outside resources if you need some help. Reassess the job functions. At the outset of your compliance program, you should definitely evaluate those individuals who need to handle protected health information, and look into your business associates as well and identify how much information they need to review and handle, and make sure they're also following HIPAA guidelines and have signed a business associate contract. So we would invite you to lead out in creating a culture of compliance. Those of you that are doctors, those of you that are practice managers, whoever you are, lead out in this. Bring this before your organization and talk about ways of creating a culture of privacy and security. This is this is one of the biggest challenges facing the healthcare environment. Again, with all the technologies that are changing and emerging and disrupting the healthcare industry. I mean, you can have VR, virtual reality. You can have wearables. There's so much that's coming up. And so this is the time, and now is the place. So privacy and security are best achieved when the overall atmosphere in your office emphasizes that confidentiality, as I mentioned. And leaders that do emphasize that, it revolves around communication. And we've suggested that in many different ways. And so leaders communicate consistently your expectations that all members of your workforce protect patients' health information. Now, we're going to talk about different ways of how we communicate. And certainly you know best in your own environment how communication is working and whether it is working, and the different forms that you have available. Guide your staff to comply with, implement, and enforce your privacy and security policies and procedures. And the third way we would suggest creating a culture of compliance, these action steps, remind staff. Keeping health information confidential is so important to patients and your practice. How can you do that? You can do that in staff meetings, and you can do that impromptu. I think impromptu is going to be the absolute best way. And oftentimes that is in breach. Unfortunately, internal breaches have happened today in your practice, perhaps. So just, give people a heads up. So in moving forward with a culture of HIPAA compliance, here are 7 steps to HIPAA compliance, making sure you're educated and making sure you're moving forward if you don't already have a HIPAA compliance program. So before you can create this culture, you have to understand the rules, review the regulations, and learn about HIPAA. Assign the responsibility to a compliance officer. Make sure that there is somebody designated, somebody that your staff can turn to when they have questions. List your protected health information systems. Identify them. Conduct a risk analysis. And that actually goes along with 3. It really does. But assess your vulnerabilities with your risk analysis, prioritize your risks, and identify the security measures that need to be implemented. And then implement your policies and your procedures. And that includes not just communicating in action, but documenting all the policies and procedures. Document a method, create a method to address security policies, and identify the security controls to match the policies that you have. And sometimes that involves bringing on an IT team to help you out with that. And if you want some recommendations, I can provide some. Number 6 is to deliver a compliance training program. And this, we're talking about something that's formal, something that takes place regularly. all employees must receive training that's documented. And so have an initial onboarding training and then an ongoing program. Number 7 is to monitor and document ongoing HIPAA progress and compliance. So that alludes to self-audits. So you're doing that, you're monitoring, you're testing privacy and security programs, you're integrating privacy complaints and security incidents. Now, at first glance, if you're a private practice, you may say, that's what a hospital should be doing. That's way bigger than we are. We don't need anything that's that robust. Let me suggest that private practices are who's being targeted by hackers. Let me suggest that with all the hats many people wear in private practice, that the likelihood of you receiving a breach increases significantly. Please consider that of all the people that need these 7 steps of HIPAA compliance and should start taking these steps is you. And what we'd invite you to do, leaders, is cast the vision. Now, many of you have been in leadership roles for many years, and so you'd probably agree that leadership has peaks and valleys. Okay. One of my favorite quotes is, "I love it on the mountaintop, but it is in the valley where I grow." So many of you watching this may be in the valley. Many of you may be on the mountaintop where you're already doing things. In fact, some of you I know watching this are consultants who have done a very, very good job in one practice and have decided that you're going to help other practices that just have not done as well. And I compliment you for that. We share a very similar mission. But wherever you're at, you need to cast the vision. Okay. And that goes so far as, again, to say the 3 things that I mentioned, where you're communicating, you're guiding, and you're making sure you're constantly reminding your practice on what to do. Well, I want to take you through just a quick case study on communicating. In this particular instance, this is a woman that we are going to call Jill. Jill went back to her office after talking with her front office staff, and she says to herself, they are going to quit soon. I just know they will. She had been talking with them about a HIPAA incident that had occurred in their office, and things got kind of scary. And Jill and her front office staff complained about HIPAA together and talked about how annoying HIPAA regulations are. By the time of the conversation ended, Jill and her front office staff were all worked up and visibly annoyed at working in this industry. Has this ever happened? Have you ever got together and just had it out with all the issues with compliance and with regulations? Well, as leaders, what kind of a message does that send as doctors or practice administrators? Okay. Now, the elephant in the room is that certainly regulations keep changing. It is hard to conform. But if you think about Jill's approach, if she had approached the office staff with a different approach, she could have had a different outcome, where instead people are implementing things more proactively, and it improved, could have improved efficiency. Really, the opportunity with staff could have been an opportunity for Jill to teach the staff about the importance of following HIPAA regulations, the families that are protected. She may have shared some experiences. She could have said, we care about protecting our patients' PHI just as much as we care about our patients' treatment. So just note mentally that by taking a positive approach, just like Jill could have instilled an important lesson for her front office staff, after this presentation, you'll have a real opportunity to take some information to your team. James Hume has said the art of communication is the language of leadership. Consider how you will communicate. I don't think you need to communicate as if you're talking to a puppy per se. We have a little puppy, and my kids treat our puppy like it's a baby and talk to it like it's a baby. But what I'm suggesting at the outset of this important principle is, whether it be written, oral, or verbal, effective communication is the cornerstone for any leader to build upon. So just know it's critical that a leader can communicate information in a way that can be understood by the intended audience. And so, as simply as you'd talk to a dog in this case, or maybe communicate in a way that the audience can understand is where we're getting at. So, for example, a leader will give instructions on how to accomplish something. So they would then ask the person receiving the instructions to confirm ending. And so know that communication, it's a two-way and active listening relationship, and so active listening is just as important as clearly speaking. Biggest communication problem, a lot of people will say, in fact, we have a billboard with a man, lots of different people on these billboards here in Utah with these big ears that are put on the sides of all these faces. And their marketing campaign is, we hear you. That's their whole marketing campaign, and it's been extremely effective. Extremely effective. So, in today's day and age, we don't listen to understand. A lot of times people will listen, but they just don't understand. It's like that kid that in the second grade that had his teacher say, "Hey, it's really muddy outside, and so I want you to make sure that everybody that comes in cleans off their feet before they come into the classroom." Well, the kid comes into the classroom with all of the other students. There's a mud trail. And the teacher says, "Johnny, didn't you hear what I said about wiping your feet off before you come into the classroom?" And Johnny says, "Well, I heard you, but I just wasn't listening." Right? I mean, that's kind of, it's a challenge for a lot of us. I'm going to say myself absolutely included. My wife would agree. All right. So there is a big difference between hearing what somebody is saying and actively listening to what's being said. And that's what I mentioned just a second ago. There's no reason I have, two pictures now of dogs. It's not because we just got a puppy, but the ears work in this case. And it's been said that you have 2 ears and 1 mouth. And so we should probably consider utilizing them in proportion. And leaders who actively listen to the staff, the results, a trustworthy relationship that breeds transparency, that breeds loyalty. And active listening, it really shows a leader that cares. It's been said that people don't care how much you know until they know how much you care. So it shows a leader that's engaged with important matters, that they're able to show empathy, and they become more aware of verbal and nonverbal signs. And the last thing I would say is, when you talk, interrupt. Okay, so when you have meetings and things, do not interrupt in developing this culture where you're communicating things. Now, by communication, how often should you be communicating compliance? We have people that talk often about communicating them in every Monday meeting. We have people that do it quarterly. It really is up to you. But as things change, the more things change, the more important it will be to get together with people. Each employee, each staff member is unique, and there may be people that have pushback. There may be people that are more receptive to implementing policies and forms. Your compliance officer should be in-house, as you're going to be much more effective if you're constantly communicating, if the same person's constantly communicating what should be done, and they're also somebody that is implementing compliance procedures. So how you approach people is just as unique as they are. And just as you'd never approach every situation you're faced with in the same manner, you should always approach each staff member based on the individual that they are. And one of the last things I'll say about active listening is through active listening, you'll have a better understanding of how to communicate to individuals, which will ultimately help you communicate to the group as a whole. So the second thing is the guide. So as the guide, as the compliance officer of a compliance program, you may feel like your to-do list is everything. Well, as a guide, to be truly effective, really, you need to be focused on the overall direction of the team with compliance and identifying which parts can be delegated where everybody is working together for that compliance. So it goes without saying, when a leader tries to do everything themselves, believing they're the only one that can do things right, this really minimizes your valuable time, and it really weakens your ability to accomplish assigned tasks. There's a book out there by an author, Rory Vaden, called it's called Procrastinate on Purpose. And he talks about four different decision-making tools. And this is something I think should be understood by every leader that's implementing this culture of compliance. So any decision being made goes into this funnel. Okay, he calls it the POP funnel. And on top of this funnel, when making a decision, you first determine, hey, do I need to make that decision? Is this even a decision we need to worry about? The second is this something that I could delegate to somebody else? The third is, well, if I don't have to delegate it, could I automate it? Is there a system out there? Is there a healthcare service or something out there that I could have this automated where they're doing a bunch of it for me? Or the bottom of the funnel is to procrastinate it on purpose. And the concept he gets across is, if it is something to procrastinate, then you basically pop that decision up to the top of the funnel and then go through those same criteria again to determine if a decision is worth being pursued. Okay, so is that helpful? Is that something that can help you as a guide? Because sometimes as a guide with certain things, you don't need to implement it. And I'm going to bring this now to compliance and to say there really are certain compliance procedures that don't impact your practice. And so, if you'd like, I can provide some guidance on that. If you want to ask some questions afterward, I will give you my email address. But as a guide, certainly you have to know your employees' skill sets. You have to trust in their abilities. And once you can understand their key results areas, how they're involved with handling protected health information, you can then assign them important responsibilities. So you can incorporate that culture. But you have to be the guide in this. Just trusting that compliance is going to be communicated. Okay, just don't show, I mean, if you take the attitude of, we'll just, don't talk too loud about people. And, I always hear talking with healthcare providers that they have, they don't have a formal compliance program, but they whisper things and they keep passwords private and they do a few things. And I think that's great, but there's so much that's being missed. And that's why people are receiving so many breaches and are being audited as a result. One thing about delegating something, when you delegate some assignment to another person, did you know their respect for you increases when they're fulfilling that assignment? Did you know that it builds their innovation, their morale, and their satisfaction? It improves the culture. They feel like they're part of something. Okay, that could be one of the most important takeaways. Okay, so by understanding your people, understanding their functions, understanding how to communicate to them, you'll understanding their, and write this down, understanding what motivates them, understanding what their values are. It can help you you can tie all of those in to the vision. And once they, again, pursue an assignment from you, their respect for that vision, well, it goes just skyrocket. It just skyrockets because they begin to take ownership for the organization, ownership for the vision. So it is crucial for those who are leading out with a culture of compliance to show that you trust your employees, you trust your staff, and you'll find your character as a leader will improve. I guarantee it. Abraham Lincoln said, nearly all men can stand adversity, but if you want to test a man's character, give him power. Okay, those of you watching, you have the power to make change happen here. Okay. Another case study that I want to go through. Okay. So Carol told one of her staff, Amy, particular assignment. Although Carol did not see the value of that assignment, she does follow through on what she has been told to get done. And the project ended up being one that would be very time-consuming, very tedious, but it needed to get done. So, like Carol, Amy was less enthusiastic about the project. Although Amy did complete the project on time, it was not done very well, and there was a lot of mumbling and a lot of complaining throughout the entire thing. Have you ever had this happen where you're less enthusiastic to implement something? Well, if Carol would have understood the importance of the project and had some more enthusiasm about it, then she may have presented it in a much different way, and it would have been accomplished with much more integrity and a much higher quality. Okay, so just as leaders, if you can take away the fact that your guidance to somebody like a compliance officer who then implements things is just so important. Okay. As you're seeing in front of you, okay, these are people that are supercharged about their environment, about their culture. Now, you're going to see people that are this happy when it comes to compliance, you might. Okay, you may have those rare situations, but may I suggest that what you're seeing here is the result of you serving your practice by implementing a culture of compliance, by implementing a culture, one that communicates, one that guides, one that keeps people accountable and reminds, and we'll get into that in just a second. But being a good leader, it really is just a basic variation of being a good parent, if you think about it. Qualities inherent in a good parent are character, consistency, dependability, accountability, knowledge, good judgment, selflessness, respect, courage, discipline, fairness, and structure. And these are the same qualities, really, that are inherent in being a good leader. And so, yes, we're talking about a lot of leadership here, because certainly it is a challenge for a lot of doctors who are very overwhelmed, and a lot of practice managers and office managers that are very overwhelmed. To be a good leader, you must care about the lives and the welfare of your team members. And you need to demonstrate it with concern and support within a disciplined environment. So we just encourage you to know that your leadership is synonymous with service. And another way to look at this is, you need to lead with love for your patients and for your staff. John Wooden has said you must have love in your heart for the people under your leadership. So now we get into remind. Okay, so this is the third part, and we've kind of alluded to this throughout. So some key points in reminding and keeping people accountable continually is to educate your staff about the iterative and ongoing nature of this process that is implementing a culture of compliance. It really is a process. We usually think it takes about a year before practice can really feel like they are implementing something that is beginning to run on itself. So keep in mind that risk assessments are a huge thing. Self audits. That's what you get for clicking a notification. Yes, thank you. All right. Make security a high priority. Have an action plan that clearly assigns responsibilities for each risk analysis component. Involve your EHR developer in the process. And ensure that your risk analysis is specific to your practice. Now, these reminders, again, I've heard at every Monday meeting, staff are reminded once a quarter. It really does, really has a lot to do with your own practice. How do you determine how frequently to remind? Well, it's just going to start with your first self-audit. And so if you didn't see the last presentation, the first presentation really gets into more of what you should be looking at with a self-audit. By way of quick reminder, here's a compliance health checkup. Okay, you've got to look at your policies and your procedures. You've got to look at the ongoing documentation and understand which documents are ongoing, which forms. The training, what's being done for training, what's being done for VA contracts, risk analysis, risk management action plan, security incident, and breach management. Okay, so these are the different factors, and we'll get into more details of these in the upcoming weeks. Here's a compliance health checkup that I'll often take into a practice, and something that they leave that I leave with them, and they put in their books. If you're interested in this, I'm happy to send this to you. This could be a quick checkup. I have actually got a much more risk assessment that will give you a 360-degree look on how your whole compliance program is being done, and I'm happy to email that to you at no cost. And I'll give you my email address at the end of this. Well, the penalties for a HIPAA violation, if you determine that you want to turn the cheek and not implement this, well, it can be a $50,000 penalty per violation. Okay, that's at the very bottom. Willful neglect not corrected. Okay, so if you're audited, that is going to be your fine. If you adopt a different attitude where there has been willful neglect, but you determine you want to correct things at that time, it's still $10,000 to $50,000. Okay, reasonable cause, did not know what to do. I mean, those kind of things, they depend, but certainly on the minimal scale, the fine is much less. So this kind of looks like the diagram I put forward in the beginning of this, but let me just change it around a little bit. And instead of the patient having a problem, okay, let's then look at this at a compliance standpoint. If you are in the position, physicians, where you have a problem which is no compliance program at all, I hope that you will determine to go to a guide for protection. I hope you will continue to watch these webinars, these presentations. I hope you'll ask questions. I have a lot of resources that I could provide where you can do things in-house. Okay, I can help you with a plan. And I say that because not everybody finds that our program is a fit for them. And that's okay. We're okay with that. But I'm happy to show you a plan and give you details on how to act on that in a proposal. Very simple proposal. I think you'll be amazed. Which again can produce some positive results if you do determine to, so again, whether it be in-house, get a consultant, use an online solution. There are several different things, or produce a negative where now you know, but your willful neglect can then end up biting you. Permit me to share a little bit more about these options. I will be giving you an introduction to healthcare compliance solutions, where we like to say that we make the pieces fit so you don't have to. We want to help you to do more with less. We feel the gravity of your decisions, that they need to lean toward patient care, and we want to help you get back to that. Before I start, again, let me just remind you that I can provide you a security risk analysis to help you to have a 360-degree view of compliance and of the corrective and preventive actions that you need to start making. But we suggest that this is the very first place you should start. Conduct a self-audit. And again, you don't have to do that yourselves, doctors. Well, with training, training can be done online. You can do it, have a consultant, or you can do it in-house. Want to talk about some of the options, okay? I think a consultant is fantastic for many things. If you have a consultant that is doing many things for you, I think a consultant can be very cost effective. When you look at the positives and the negatives financially, consultants can be very expensive. Many consultants will charge up to $600 an hour. I have personally interviewed consultants and have connections that can do this for a much better deal, and can actually help you to improve a lot of other areas of your practice management system. So I know I'm not saying that a consultant is a negative thing. Let me just bring some some sense to why I have the negative. So if you determine that you want a consultant to come in to write up your policies, to train you, uh, a consultant can't, how can they really be a compliance officer where things happen real time, implementing forms, making sure that certain logs are being conducted. You have a new staff member that comes in and they need their initial training. Are you going to have a consultant come each time? Are you just going to have them, read all your binders? Consultants, they don't know your practice like you do. And in terms of filling out the information to fit your practice, certainly they have a skeleton overview, but things are going to change over time and need to be adjusted over time. And so that can be another challenge. There's some great consultants out there that would argue every point that I've made, and so you've really got to do your own homework. But this is based on some of the research I've done. Now, if you do it in house, really time is the main challenge here, and I think everything is best when it's ultimately turned over to where you can do most everything in house. I think probably the exception of training. I think training, yes, you do it ongoing, but initial training, the training that's, what the law would want you to understand about the full scope of the compliance regulations, should probably be done by somebody who has been trained to do that, a trained compliance officer, or a company, or a presentation at, maybe a convention or something. The online, there are pros and cons for online. The online options have their issues. Really, giving somebody login information for training, if we're just talking about training in particular, well, if you don't tie that to a performance review and say, hey, by this date, you've got to have your training done, sometimes it won't get done. Okay. And so you've got to have an online option that says that tracks who has and hasn't done the training, and one that can be integrated with other elements of compliance. Okay, so those are just some things to consider. 3 things to expect with HCSI. We have a membership website portal, and I'm going to get into each of these. We have done for you compliance binders, and we have ongoing support. Okay, so 3 things that are very simple. As far as the training, we do HIPAA privacy, HIPAA security, OSHA, Medicare, and employment law online for new employees and for all the retraining. And so everybody has their own login information. There are screens that they have to click the next button and click I agree, and make commitments to implementing certain policies and procedures. And I think our system does a pretty good job. Our manuals are, there's a reference guide that we send for compliance officers, compliance plans binder, which is handed to the auditor should you be audited, and a training certificates binder as well. We've recently added a business associate contract binder just because every year we recommend that business associate contracts are reviewed and that you get new ones signed by the business associate, especially when there are things that have changed. So important that they're following HIPAA, because they are really the leaders in a lot of the fines in the healthcare industry. And if you have business associates that have several different, and if you're a business associate and like an anesthesiologist group, for example, and you're tied to all these healthcare practices, one day you may be like the anesthesiologist that contacted me saying, hey, somebody broke into my house and took my laptop, and now a lot of patients through several different providers are in breach. What do I do? So we have a business associate contract binder as well. We provide a consultative relationship. We like to look at ourselves as a compliance business partner, really. And so to facilitate ongoing culture of compliance, we have weekly and monthly updates that are emailed. We do a quarterly newsletter, which is actually the quarterly newsletter that you're seeing on the front. You're seeing right before you. And these newsletters are the top red square, if you're looking at the image, is a place for you to have your staff initial. And we have people staple a lined piece of paper for people to initial and date with the much bigger organizations. We do get a lot of smaller practices due to the challenge it is to do compliance amidst many other things. And so if you're a small practice, we'd invite you to check us out. On an email support, and we do a quarterly assessment. Now, what that quarterly assessment is we have an implementation specialist assigned to your account, and this is probably one of the differentiated features. This person will contact you every 3 months, review your account, who hasn't done training, whether you've done the risk assessment, whether you're doing self-audits, bring you up to speed if there are some real changes with any of the regulations. They really are a compliance coach for you. All the forms are customizable, and so you'll be able to open up a Word document and add things. And to the left, you have things like the gap risk analysis. You have there's a lot of different forms that must be customized for your office. Customer testimonial, our HIPAA. OSHA compliance was a huge concern in our office, especially after one of our employees filed a complaint with OSHA. Okay, there you go. This was just a few months ago, actually. We started using HCSI this person sent me the testimonial just a few months ago, reiterating how much this had helped. Yes, let me preface that. We started using HCSI 4 years ago and couldn't be happier with the program. It's simple to set up and easier to use. Do it yourself a favor and sign up. It will make your life easier. Well, we sure hope so. This one's pretty funny. HCSI kept my fanny out of the who's cow with a cranky, which means a bit weirdo psycho is how Lee described this person, who thought a patient who thought we'd been naughty in multiple ways. Our association with you made all the difference. We passed the inspection with flying colors, and OCR told the patient to bug off. Loved it. Okay, so there's just a couple of simple examples. We have several other testimonials if it makes any difference. We also have a 30-day money-back guarantee if you want to give us a try and begin training today. Here's the price breakdown of the training. In addition to that implementation specialist, one of the most unique things that we offer is a compliance officer training. And we value that. I mean, really what would have to happen is you'd have to have a staff member go to, say, a community college to actually have a compliance officer training. And they would learn the ongoing internal compliance procedures. They'd learn how to communicate, a culture of compliance, etc. But we offer that in the training, and then we provide a coach for you. Okay. We do the staff initial training and retraining, the risk analysis, customizable compliance plans, customizable forms, posters, compliance updates, emails and newsletters, phone and email support. So we offer all of this. And, if you were to add that up, I mean, you've got a few $1,000s here, and we do allow you to pay. We don't do any contracts, but if you wanted to pay 5 years, we can give you a little bit of a discount. Our first year is a different price than the second year. But for 5 years, we will give you a deal at $2,600 as the base. It's a $3 per employee side to this. Or if you want to just start 1 year, it's $11.89 base and $3 per employee. Now, if you email within 24 hours, you will receive a $300 discount code. Okay. Now, if you watch this and it's your first time watching this, then I will honor a $100 off discount, which I think is more than fair, because many people have watched this video today, and I think it's only fair that I give this to you. So the company's enabled me to give you $300 discount. You need to email lking@hcsiinc.com. Now, one thing that you need to consider is you can email me within 24 hours to receive that discount code. Today is Friday, so I am going to be here for about 2 more hours, and then I don't usually check my email. I don't even know why it says 24 hours. Why don't we say 2 hours? Why don't we say 2 minutes? Okay, if this is something you want to do, in fact, I'll check my email as soon as this is over. So I'm going to reiterate a few things while you're thinking over whether this could be the right solution for you. And we have a demo. If you want to watch the demo, it'll get into some of the trainings, give you an example of what the trainings look like. It will show you some of the quizzes. It'll show you what some of the, just give you kind of an inside view of what the program's like. But as far as the compliance officer training, I just wanted to emphasize that is really a differentiated piece to this whole puzzle of how do I integrate a culture of compliance. Success with this is best done with a compliance officer. Many compliance officers, they may feel overwhelmed with every other hat of responsibility that they have, because they're probably the office manager, the practice manager, and then they have compliance. I mean, that really kind of overloads them. So we coach them through things, and with the policies and procedures, we help things to be organized. I've literally seen practices where things look like this. And then with the quarterly assessments, hey, we realized that compliance officer might be all over that compliance program in the first couple months, and then need a reminder in 3 months or in 6 months down the road that there are some elements that they may or may not be implementing effectively. And each call is very unique in terms of what the focus is of each call, so as not to overwhelm the compliance officer. Well, my name's Lance King. I'm the Vice President of Sales at Healthcare Compliance Solutions. It really has been my privilege to serve you in this presentation. I just wanted to say one last thing. Again, email me within 2 hours. Email me within 2 minutes, and we'll get you that $300 discount. If you're watching this for the first time, I will give you $100 if you email me within 24 hours of viewing this presentation. Okay, but I have a story to share just real quick in closing. I have a motorcycle. My father-in-law gave me this motorcycle, and actually 2 motorcycles, and one of them was a Honda 100, and one of them was a Yamaha 225. So the Yamaha is what I should probably be riding. I'm 230 pounds, 6'1", and to get on the little Honda 100, I bottomed that thing out. So anyway, I get these bikes. Well, the only one that works really is this this Honda, and this Yamaha, I just could not get the thing to stay idle. It would just, I mean, I could get it started real quick, but then it would die right away. So a neighbor who fixes motorcycles, and this neighbor's 16, by the way. He's just so smart, so gifted mechanically, and in so many other ways. Just such a great young man. He offers to help me out. He said, "Hey, I'll clean your carbs. I'll get this fixed up for you." Well, the first took him 2 days. He took everything. I mean, took everything apart. It was insane, all that he took apart. I was really worried he was not going to be able to put it back together. Things were all over his garage. Well, he gets into this. He gets into this project and then puts it all back together, thinking that he got it going, but it didn't start. So he takes the carburetor apart again and decides he'd look at this pilot jet. Well, the pilot jet, what I've recently learned, is where all the gas goes into. It goes into this little teeny pin, like, I mean, a couple centimeters tall, like 1 centimeter wide, and then this tube you should see light through was, like a millimeter. It's just really, really small. Well, this pilot jet, we eventually got this pilot jet out, and this pilot jet looked like it was just concrete through. I mean, no light. You couldn't blow out what was in there. We had to replace this pilot jet. Well, we replaced it. It cost, pennies basically, and put it together, and the bike runs amazing. I mean, it's purring. Well, I bring this up primarily because, again, just as in the beginning of this presentation, we went through that exercise where you read a sentence, and the sentence, we identified the number of F's. With, corrective and preventative action, a lot of times the smallest things can be the biggest deal. And so, again, I'm going to invite you to get a risk analysis from me so you can identify what some of these smaller pieces, and just how important they are in the overall effectiveness of your program. And just want to let you know that we're here to support you in creating a culture of privacy, security, and safety for both your staff and for your patients. Thank you so much. We are Healthcare Compliance Solutions, your compliance business partner for HIPAA, OSHA, HR, and Medicare. Connect with me on LinkedIn. We also have a podcast called the Doctor Entrepreneur Podcast, where we interview doctors who are scaling their organization. We interview healthcare services. It's for doctors to know what works with healthcare services. And I hope to connect with you soon. Make it a great day. Thanks so much for connecting with us.